Hello and welcome back. In this video, we're going to be discussing service delivery planning. This is chapter 8. So, the change in status from applicant to recipient of services marks the move into the second phase of case management, which is planning service delivery. During this phase, case management, the helper and the client determine the steps necessary to reach the desired goal. So activities in this phase include reviewing and continuing to access a problem, developing a plan, using the information system, and gathering additional data. So two other critical components of the case management process are client participation and documentation, as we discussed in chapter 3. So revisiting the assessment phase. Before moving forward, the case manager needs to know if the problem has changed, if there's the same client resources available, if there's any shifts in HG priorities. The first area of concern involves the review of relevant facts regarding the problem. A second requires an examination of available information to answer the following questions. And they are: what do I know about the source of the problem? How does culture influence in the client environment? What attempts have been made to resolve the problem? What are the motivations for the client to solve the problem? What are the interests and strengths of the client that will support in this process? And what barriers may affect attempts to resolve the problem? So the client is still considered the primary source of information. Talking with the client can reveal what they have thought about doing, what has been tried, and what are some possible solutions, and what solutions do they have access to. Using observation opportunities and rereading documents helps in reviewing the problem. And once the case manager revisits the problem, confirm its existence, document any changes, and reaffirm the client's desire for assistance, the next step of the planning phase, which addresses the need to determine the steps necessary to reach the identified goals, then starts. So let's talk about the plan. This is a written document in advance of service delivery that sets forth the goals and objectives of service delivery. So a plan documents how services will meet the client's needs and how meeting those needs will lead to the desired outcome. So plan development, a process that includes setting goals, deciding objectives, and determining specific interventions. The process begins with the synthesis of all available data. So beginning case managers can use the following steps to develop a plan. Reread the client's file. Assess the record conclusion, contradictions, and notes missing. Review the assessment with the client and make revisions according to the client's input. Add client's motivations, strengths, interests, and cultural considerations, and describe desirable outcomes. So service. These are plans are goal directed and time limited. So they include both long and short term goals. Long-term goals state the situation ultimately desired. Short-term aim to provide the clients through a crisis. So goals, these are statements that state a condition or intent. I usually tell my case managers to put these in quotation marks, right? So a goal is a brief statement concerning what they want. Written goals can help to focus on what needs to be accomplished and guide subsequent actions. Goals must be understood so that they should be well stated and reasonable. To achieve this, the goal should be expressed in language that is clear and concise. The goal should be unambiguous, and the goal must be realistic and achievable. So goals are important because they increase the chance of solving the issue. After goals are set, the case management client will identify activities or objectives that can lead to the desired outcomes. So objectives is intended to result of the service provision rather than the service itself. So they're useful because they can tell us where we're going. They give us client guidance in organizing the efforts. They make evaluation possible. They provide the standards by which progress is monitored. They're clearly defined objectives, benefits the client, case manager, and the agency. The Center for Disease Control and Prevention created the SMART model, which is the goals they should be smart, measurable, achievable, realistic, and time phased to support writing and evaluation of the service objectives. So being specific means that objectives should be provide who and what of program activity. Only use active action verb to make sure only one objective has been measured, and avoid using verbs with vague meanings. Measurable. They need to be the objectives cannot be documented as achieved unless they are measurable. So measurability also allows us to monitor the objectives. Measurable objectives provide a reference point which the change should be observed. They need to be achievable, meaning that objectives should be achievable after the plan is often implemented. Also helps that sets targets and accountability and are source for program evaluation. Realistic. They most useful when they accurately address the scope of the problem and are applied to programmatic steps that can be implemented within a given time frame. Objectives that do not directly relate to the program goal will not help achieve the goal. They should be time phased. So they should provide a time frame indicating periods for measurement and the time within which the objectives can be achieved or will be achieved. So developing a plan of service. So they should be written. Written objectives help eliminate memory issues. Issues ensures that the client and the case manager agree about what the client will be working on. We need to have consistent with resources. A statement of an objective must be consistent with the available and anticipated resources. Individually accountable. An objective should avoid or minimize dual accountability for achievement. Consistent with rules. Objectives must be consistent with agency-based policies and practices. Voluntary. The client must be willingly agree to the objectives and communicate it personally. The objectives must be communicated not only with written but in face-to-face discussions with the client. Identifying services. A well-developed plan provides information about what the service is and who will be providing it, and what the time frame is, and who is overall responsible for service delivery. Case manager identifies services, which again that help the client access existing services and help other service providers relate better to the client. So information and referral systems. This is a systematic way of developing and utilizing knowledge of the human resource service delivery system in the community. There are three components to information and referral. The first is social services directory, a listing of the kind of problems handled and the services delivered by the agencies. Feedback logs provides feedback to the agencies that deliver services to help ensure quality information and referral services. And another component of information and referral systems is staff training and networking. So setting up a system. The first step is establishing one's own information and referral system is to identify all agencies available in services. So each agency and service becomes part of a card file, computer file, or spreadsheet. There's more than one resource to serve the client's particular need. The case manager works to identify the agencies that can meet that client's need. So good research skills are helpful because the case manager continually works to locate potential resources for the client. Gathering different information is an important part of the process. To determine whether additional information is necessary, there must be a review of the available information from other agencies, referral sources, employers, and others. The key is determining what the service is needed is relevant, and the case manager can personally acquire the needed information, but it may also be necessary to consult with family members, significant others, or other professionals. So two primary tools are available for data collection, which are interviewing and testing. The information from interviewing and testing is used to describe, to make predictions, or both. Interviewing and testing may occur in an individual or group situation. It can both be computerized. So assessment interview, an interaction that provides information from the evaluation of an individual. So a structured clinical interview consists of specific questions asked in designated order, structured by guidelines to ensure that all the clients are handled in the same way. The major limitation is reliance on the respondent as they to be honest and capable interviewee who has the skills to self-observation and insight. So a case history interview. This is a more comprehensive interview that includes open-ended and specific questions. Topics may include chronology of major events, family history, work history, medical history. Mental status exams are interviews used to diagnose psychosis, brain damage, and other mental health problems. Sources of error. These are sources of potential bias in the instrument itself or the interviewer. The halo effect, which is when the interviewer forms a favorable or unfavorable early impression of the other persons, which are biases that remainder of the judgment process. So this is general standout-ishness. This is the tendency of the judge the basis of one's outstanding characteristics such as personality or appearance, or personal appearance. Cultural difference can contribute to error. Error reduces the objectivity of the interviewer, often leading to inaccurate judgments. The reliability of the interview is this consistency of results. In general, interview data may have limited reliability because interviewers look for different things, have different various interviewing styles, and ask different questions. So testing. Case managers encounter tests in various contexts. Test scores may be a part of a written report and may services offered by the agencies. So a test measures is a measurement device. A psychological test is a device for measuring characteristics that pertain to behavior. Decisions should not be based on solely on the test scores, but they can help you justify or clarify why we make certain decisions. Maximum performance tests. These are tests such as achievement tests, aptitude tests, or intelligence tests. Achievement test is used to evaluate an individual's present level of functioning. Aptitude test predicts the client's potential. Intelligence test measures the client's some aspect of their intelligence. And typical performance tests give an idea of what the examinee is like. Tests can be standardized or informal. Selecting tests requires an understanding of several concepts and variables. There are many sources of information about tests, ranging from test publishers and reference books. And case managers who is involved in testing should carefully review the relevant testing standards. So criteria for selection. There are three primary considerations for test selection: validity, reliability, and usability. So validity is the most important of those. This is the extent to which the test measures what we actually wish to measure. Reliability, the degree to consistency which the test measures whatever we're supposed to be measuring. And usability includes the practical factors, the part of the decision to use a particular test. Administration and interpretation. The test manual should identify any special qualifications in training, certification, and experience. It is the responsibility of the test administrator to be knowledgeable about the specific test and its uses. So administration and interpretation. Standardized testing administration procedures are important, and conditions that may result in deviation from should be eliminated prior to testing. So limitations and disabilities must be considered in relation to test performance. When a test is given to people who are different from other groups, the test was designed for or normed on, is more difficult to get accurate results. It is the responsibility of the test administrator to interpret the scores and accurately and meaningfully. These are two essential steps in test interpretation: understanding the results and communicating them to the person. The following suggestions are helpful in test interpretation. Know the test, avoid technical issues, use the test profile as a graphic presentation of results, and explain the score means in terms of behavior, and then go slowly so they can make sure they understand what's been told to them. And test scores do mean something, but in order to know what, we must consider each examinee as an individual, combining test evidence with everything else that we know about the client, all the other information we have about the client. So cultural guidelines. Whitfield, Whiting, and Ford provide guidelines to considering bias. Translate tests in the language of the examinee. Use interpreters to translate test items, if need so. Examine all test items, tasks to see if the group performs differently, and eliminate those items. Eliminate items that are offensive to examinees. When interpreting test scores, always consider the examinee's background and experience. Do not support assumptions and homogeneous experiences or equal opportunities to learn. Never base decisions on the test. Do not interpret scores in isolation. When an individual or group has a low score, consider the test may be a problem. If a group consistently performs poorly of an intelligence test, then explore contributing factors. Always consider the technical or social merits of the test. Review norming and sample sizes, and include culturally fair or culturally reduced tests in assessment. And always use and interpret test scores with testing principles. Test misuse can occur easily. Case managers should select tests that have been carefully reviewed. Case managers should use only tests that are qualified to administer and interpret, that they have the ability to do so based on what the test administrator's requirements are. And case managers who administer tests have an obligation to provide an interpretation of the test results.